Well, this is the new normal. After 2 months, we can finally go inside for a bite to eat or a drink. Social distancing is in full effect in places like Chameleon in Northside, where shower curtains are between each table. And the guy in scrubs, he's checking the temperature of everyone who walks in the door. Good afternoon and welcome to First Financial Biz Beat presented by the Business Courier. I'm Kyla Woods. Well, for the first time in months, we can finally sit down for an old-fashioned meal inside. Of course, things aren't exactly the same. You have to ask for salt and pepper at places like Tano's in Hamilton. Down the road at Casual Pint, there are disposable menus. And at the Echo in Hyde Park, you get to scan a code before you can get to the menu on your phone. But everyone we talk to says those are minor prices to pay to be able to enjoy a meal at their favorite restaurant again.
I think just spontaneous interactions with folks and seeing friends and coworkers out again is a good feeling.
We always have, people that come in here and just excited to be here, and they look forward to their cheeseburgers and their regulars, and I really miss that atmosphere. You don't really realize that until it's taken away.
And banquet facilities can reopen on June 1st, which is a huge piece of news for weddings, though you can't have more than 300 people and there's no congregating. But as for more parts of the economy reopening, there's still one big economic engine with a whole lot of question marks. On this week's front page centerpiece, the big fall test local colleges are facing. The University of Cincinnati has a 4-part plan. It begins with researchers coming back June 1st. They'll be joined by employees about a month later and more on August 3rd. And on August 24th, the fall semester begins, although there's no plan yet for bringing students back or what classes will look like.
I'm concerned with safety more than anything, though. And I mean, whatever you have to do just to be safe, I think that's the most important thing to do above anything else.
I'm just trying to stay positive. I definitely want fall sports to happen and all the fun stuff to happen.
And those fall sports may very well happen. The NCAA gave the okay for voluntary workouts to start June 1st. Courier reporter Andy Brownfield joins us to talk about when and how schools will welcome students back. Andy, great to have you with us.
Thanks for having me.
Well, what are the key factors helping guide those decisions for local campuses right now in how they consider how they'll reopen?
I think right now the biggest concern is what the state of the pandemic is going to be when fall semester is supposed to start. There's been talk of potential secondary outbreaks later in the summer and early fall, so colleges are preparing a lot of contingencies. Most of them would love to have students back on campus this fall, but in the event of an outbreak, there may have to be more virtual learning in the worst case, or things like shortened semesters, delayed starts, or maybe even early starts, depending on just what guidance they're getting from the Centers for Disease Control and from Governor DeWine.
And of course, there's a lot to consider and also some very interesting data included in this story. What metrics stood out to administrators when determining how to approach those fall classes?
Well, I think, again, safety is key. And for bigger campuses and bigger colleges, it is a numbers game because they just have so many students and such limited space to house them all in classes, lecture halls, laboratories, and dormitories, that if they are required to have 6 feet of social distancing between people at all times, it's going to be really tricky. Now, some polling also shows that students are a bit wary of returning to campus this fall, too. If there has not been a vaccine or a cure, something like 4% say they just will put off education for the time being, while another 31% or so say that they will continue distance learning or virtual learning as opposed to return to campus, though a majority, 65%, did say they would return to campus.
And you mentioned housing there. What are some of the thoughts around housing and the need to implement the distancing in the dorms?
That is a big question looming over these colleges for fall. They house thousands of students on their campuses and even more in off-campus student housing. And with social distancing requirements, things like quads, triples, and maybe even doubles will be going away. And a lot of the school administrators I've spoken with have expressed concerns that if they're required to house one student per dorm, they just won't have room for all of their students on or off campus. And even then, it's going to be a major hit to their budget without that housing revenue and fees coming in.
And lastly, there also seems to be concern about tuition. Is there a plan to possibly reduce tuition costs if students do have to remain virtual, especially considering the revenue loss that many universities are facing right now?
Yeah, that poll I mentioned earlier said that, a majority of students, I think some close to 80%, said that if they have to stay virtual for a fall semester, they'd like to see at least a 5% reduction in tuition. Now, I haven't heard of any institutions locally that are planning to do that because tuition does make up a large portion of their annual budgets. But they also, most of these schools do have measures in place to keep tuition constant and not increase it throughout a student's career at their institution.
Andy, thank you so much for your work on this story. Incredibly insightful information there. We'll keep an eye on it, and thank you so much for the centerpiece this week.
Thank you, Kyla.
Well, determination can take you pretty far in this country. Frank Daoud is proof of that. He came to the U.S. from Jordan in 1957, vowing to earn enough money to go to college. It wasn't long after that he and his brothers bought Hamburger Heaven in Mount Washington. A couple years later, they decided to sell chili, and the Gold Star Empire was born. Frank Daoud died earlier this week at the age of 83. Also sad news to report that former Ohio Congressman Bill Keating Sr. has died. Keating served Hamilton County as a judge before being elected to Cincinnati City Council and eventually Congress. He left Congress during his second term to go into the newspaper business, eventually becoming publisher of the Enquirer and later chairman of the board of the Associated Press. Bill Keating was 93 years old. Up next on First Financial Business Beat, we'll introduce you to FC Cincinnati's new head coach. And congratulations to Genevieve Holt, the Midwest General Manager of Broadway Across America, is another one of our 40 Under 40 honorees. Well, it's official. Jaap Stam is the new head coach for FC Cincinnati. In his playing days, he was a defender on 3 championship teams with Manchester United, and he's managed clubs in England and the Netherlands. He's excited to take over our club.
I'm very delighted to be part of the big family. I've spoken with a lot of people within the club already, and I know it's a very big project. Everybody's very excited to do very well and to get the max out of everything in what we're doing. That's how I am as a person as well. We like to set records. We like to win games and hopefully win trophies as well.
Stam is FC Cincinnati's 5th head coach in franchise history. Unemployment numbers are at a record high, and half of all adults have either lost income or know someone who has over the last 2 months. Yet the stock market is rallying. First Financial's Kirk Copenhaver talked about that with Courier Market Engagement Director Kelly Snyder.
Thanks, Kyla. Kirk, thanks so much for being here today. The last time we talked, it was in mid-March, and the market was in the midst of a steep decline. Now that it's rallied pretty significantly off of the lows, what's behind the rally?
To us, the main reason behind the rally is an improvement in investor sentiment, driven mostly by policy stimulus, both from Washington and from the central banks. There's been some encouraging headlines about potential coronavirus treatments and the efforts to create a COVID vaccine. And also, it appears that the social distancing has, up to this point, done a pretty good job of slowing the spread and keeping most of our healthcare system from being overwhelmed. Something else to remember is that the market isn't exactly reflective of the broader economy. So if you look at the major industry groups that have been impacted the most by the shutdown, you think retail, entertainment, travel, leisure, et cetera, those types of things. Those industries account for a large percentage of the economy. So while we're seeing their difficulties impact GDP numbers, they only account for about 20% of the S&P 500 index. So in that sense, the market's performance shouldn't be as bad as the economy's.
So speaking of the economy, there's a lot of talk about what shape an economic recovery will take. What are your thoughts?
It seemed like the market was pricing in a relatively smooth recovery process with a sharp contraction followed by an equally sharp recovery. Think of kind of a V or a U shape. However, we're not so sure that the recovery will be that smooth or strong. Just last week, Fed Chair Jerome Powell echoed this thought, saying that recovery might be slower than expected and that more policy actions might be necessary in order to build a sustainable recovery. So we see economic recovery taking more of kind of a Nike swoosh type of shape with a weaker, more drawn out recovery.
Why do you think that?
Well, I mean, much of the country is starting to reopen, but we think that people will emerge from their quarantine bubbles more slowly than expected to go shopping or to go out to eat at restaurants. Some evidence of this can be seen in the restaurant business. Open Table has been releasing data about year-over-year changes in the number of seated diners in the restaurants in their network. And the data is improving slowly, but numbers across the country are still more than 90% below where they were last year. It's not just diners that are coming back slowly. Business leaders are also reporting that they think it'll take longer for them to get businesses back to normal than they first expected. PricewaterhouseCoopers has been asking CFOs, how long do you think it will take to get your business back up to normal if COVID-19 ended today? So March 11th, 9% of the CFOs said it would take between 3 months and a year to come back. On April 8th, 34% of those surveyed felt that way. And on May 8th, 51% of those CFOs were saying it would take between 3 and 12 months. The corporations are pushing back their timelines as well. So this type of data, combined with the lack of widespread testing and available treatments at this point, it kind of makes us think that this process could take longer than expected.
So what does all of this mean for the market?
We think the markets will remain volatile. Again, we think the recovery won't be as swift or as strong as others seem to think it will be. Last week, when Powell made his comments, I think investors started coming around to that idea. For us, we're looking at 5 criteria when trying to figure out if we're out of the woods on this thing. Right now, policy stimulus is a positive, and the market's technical conditions, like the underlying breadth in the market, those are improving. The spread of the virus appears to be slowing, which is great. The reopening, that could change that if we get a second wave of infection. There's also encouraging news about potential vaccine, and that helps. Indicators of investor sentiment are kind of mixed, with equity investors being more enthusiastic than bond investors at this point. The biggest issue right now is that the fundamentals are still a major problem. Right now, many of the indicators we keep tabs on are at or near extremely low levels, but not many have shown any signs of improvement. I mean, for instance, retail sales fell 8% from February to March, and then they fell another 16% in April. GDP in the first quarter fell an annualized 4.8%. And that might not sound that bad, but that's a huge number. I mean, that's the worst drop since the financial crisis. And corporate earnings in the first quarter weren't that bad relative to expectations, but they're still tracking to be down 14% from a year ago. So these are all pretty big drops. And looking ahead, this data is only likely to get worse. Second quarter GDP at this point is expected to be down in the 20 to 30% range on an annualized basis. As for corporate earnings, many companies have completely pulled their earnings guidance for the remainder of the year. And to us, that's a signal that the next couple quarters could be pretty rough. So like I mentioned, I mean, history tells us that market rallies really take hold once the fundamental data can't get any worse. And to us, it doesn't seem like we're at that point yet, but we're probably getting closer. That means we could probably see more market volatility ahead.
Great. So very important. What are you doing in your clients' portfolios?
Right now, we're really focused on just being ready to take advantage of any opportunities the market volatility may present to us. Currently, we're a little underweight to equities and other risk assets, but we're looking for a better entry point for areas where we'd like to add exposure. Also, we've put together a shopping list of high quality stocks that we'd like to pick up on the cheap if the market dips again, we get that opportunity.
Great. Well, we really appreciate you being here, and we look forward to continuing this and having another conversation very soon. So thanks again, and back to you, Kyla.
Thank you so much, Kelly. Well, up next on First Financial Biz Beat, we chat with the head of the Center for Closing the Health Gap about how the coronavirus is affecting minorities and the help available. Data makes it clear that African Americans are disproportionately affected by the coronavirus pandemic. A statewide strike force is working on a plan to combat that. And every weekend, the Center for Closing the Health Gap hosts a virtual town hall about resources that are available. Courier publisher Jamie Smith talked about that with CEO Renee Mahaffey-Harris.
Thank you, Kyla. Renee, I'd like to thank you for being with us today to talk. I think your mission is very important, and I think getting your perspective to our community is really important as well. Can you tell me, what do you think the COVID-19 economic impact is to businesses in our Black community of Cincinnati?
Well, I haven't seen any of the economic modeling, but as I listen to experts across the nation, and the director of the Kirwan Institute wrote an interesting story about the economic impact. Do we return? If so, what does it look like as the Black community? And economically, we, frankly, economically, from a wealth perspective, have a very small percentage of wealth. And therefore, the impact on our businesses not being able to be open and whether or not they come back is really in question. And then what does that mean to the Black community in particular? Because when you look at the issue of health disparities, the preponderance of the factors that contribute to health disparities are our socioeconomic status, our socioeconomic capacity, our ability to have housing, education, good jobs, or jobs at all. All are the biggest factors that contribute to the disparities in health that we see in this nation.
Okay. We talked a little bit off screen about, your name, the name of the organization itself, the Health Gap, or Closing the Health Gap. What do you see? I think it's a big mission, but what do you see is your role right now during these times?
Well, I believe that this time there is no better evidence of why we exist. The Center for Closing the Health Gap was created to lead the efforts to eliminate racial and ethnic health disparities in greater Cincinnati. And that's not done alone. That is done collaboratively. Across this nation, the issue of disparities and the conversation on disparities really began with Secretary Heckler under the Reagan administration. And she had a data set and a study with 18 months of evidence that showed that despite socioeconomic status being equal, so you take a Black person and a white person, woman, we'll take a woman or man, same income, same education, the health outcome will be more disparate for that Black person, man or woman. And so evidence, so they did a lot of study because it's like, this can't be true. Like, how could this be? So many of the systematic and structural factors that contribute to why that exists are going to take time, policies. And, Dr. Fauci, when asked the question, why is the disparity greatest in the Black community with COVID-19? Like, in some cases, 70% of the cases are the Black community, where they represent a very small percentage of the city. And he said, how long do you have? Because the issue of health disparities didn't just begin. The light is just now shown on it in our country. And our city is, most national data bears out locally. However, we do have to do our own data gathering and tracing and work to understand the disparate impact in Cincinnati in this region. So that's why I think that today and for time to come, the issue of the health disparities will need to be an issue that's elevated as a crisis point in our nation and in our city and in this region.
How are you continuing to address those disparities? I know you probably sometimes feel like you're on a treadmill that's going the wrong way.
Well, first of all, the silver lining for me in this time is the fact that we are coming together, that we all recognize, I know there's many slogans that say we're in this together. We really are. We're interdependent. And I think now we're seeing that we truly are interdependent. And as it relates to addressing the disparate impacts in the Black community and brown communities of our region, we see that we got to do it together. And so an initiative was launched. I won't say an initiative, a collaboration was started. Once we learned that we had a national emergency, I reached out to Eddie Keon with the Urban League, Joe Mallory with NAACP, Eric Kearney with the African American Chamber of Commerce, and our newest council member, Jan Michelle Lemon Kearney, and said, we got to make sure that the information gets out to our communities in particular, and it needs to be from a trusted source. So we launched COVID-19communityresources.com, which is a site that is growing with now over 25 different organizations being in collaboration, along with the Cincinnati Medical Association, which has an Ask the Doctor feature. One of the biggest questions that we all were receiving was, I don't understand what to do if I have symptoms. I don't understand if I'm eligible for testing. I need food and I don't know where to go. I need to apply for unemployment and I'm not really sure how to do that. I have emergency resource needs that I'm not really quite sure how to direct to. And this site has 7 tabs and lots of videos to make it simple to connect to the information that people need in the Black community from a trusted source. And so I'm so proud of the work that the Urban League and African American Chamber of Commerce and the NAACP and the Cincinnati Medical Association and again, our newest council member, Jan Michelle Lemon-Carty, coming together. And it's building. So, there are now almost 25 organizations, including the COVID-19 sites of all the hospital systems are there. We are also communicating with the hospital systems. I know we meaning the health cap are and others. The health departments of both the city and county, their sites are a part of this site. And it continues to grow. Our goal is to also have information. So we have weekly town hall meetings. We finished part 6 last week with our U.S. Senator Sherrod Brown, and he said, wow, there are some really tough questions asked from the residents and from this region, and it just tells us that people need information. They need to really understand what is being done at the federal level, what is being done at the state level, what is being done at the local level, and that how can they be participatory in that process and ensuring that their needs are understood and are addressed.
Well, you know what? The thing that I like the most about that, and you and I talked earlier this week, and you cruised me through the site, the collaboration piece is so incredible. And that's how we're going to address these disparities. That's how we're going to close the gap. That's how we as a region are going to succeed, is more regional collaboration. So thank you for being such a strong leader.
Thank you.
For your cause, and we need to get you on here again soon. Maybe we can talk soon on the next interview about how businesses can help you lead your way.
Thank you, Jamie.
Today.
Thank you.
Day. Back to you, Kyla.
Thank you so much, Jamie and Renee. And thank you for joining us for First Financial BizBeat. For business news around the clock, make sure you visit CincinnatiBusinessCourier.com. Follow us on Twitter and Facebook, and be sure to sign up for our daily emails. I'm Kyla Woods. Have a great weekend.